Okay, the next section we're going to discuss is the mental health section, and that we're going to, first you need to put if the patient is in therapy now, and if so, when, where, and how long, but also in the past. So if it's in the past, when, where, how long, and if they felt that this was beneficial or if therapy is beneficial to them. You need to report whether or not they have any psychiatric directives at this time, any immediate family members that are in therapy or have been in therapy in the past, and any family members that currently use psychotropic medications. That's going to be like siblings that might have ADHD or a parent that has a bipolar medication or something on that lines. Then we're going to go to hospitalizations or inpatient treatment. This is whether or not your patient reports inpatient or hospitalization of assessment for emotional or mental health issues. This is like if they were sent to the hospital or Cherokee for suicide threats, ideations, attempts, or if they were for behavioral issues. If they do report an inpatient hospitalization or treatment, we need to note that in this section on where, when, how often, if it was beneficial, if they successfully completed this or not. Also, we need to put if any family members were in received an inpatient hospitalization for emotional, psychiatric, mental health, or in this case substance abuse issues with family members. That is noted in this section. And then you have to put whether or not these appear to be significant impairments in the day-to-day activities and the quality of life for your client. If the patient is motivated for change, and if that's positive, minimal, or questionable. It appears, that they lack the basic feeling of safety and structure in the home due to, and you would put a reason why. If the patient accepts the need for treatment and the main problems appear to be in the home and the school. The patient needs support to help stay on track, to make positive changes. It's very important to note that in this section, if you do not have that this is an issue that takes place in school or in the treatment plan, have something about the school, the worker is not going to be able to provide services in the school. So because it's very strict on how and when and why we would want to interrupt a child's school daily routine for services. If any questions, go ahead and email me. I've got to get that.